Hello all, thank you for the lovely introduction and for this wonderful opportunity to participate in your conference. It's really inspiring to see the growth of the movement and how we've increasingly trying to create space for critical discussion for global health, both in academia and in practice. So on behalf of the Edinburgh Decolonizing Global Health Group, my teammates Marike, Tiang, and I will be sharing a short presentation to address 4 things. So the first thing, we will be discussing motivations for joining the Decolonizing Global Health movement. Second, we'll talk about some takeaways and lessons from our conference that we held just a month ago in April. Third, we'll go over some positive responses that we were already seeing at the University of Edinburgh. And fourth, we'll talk about some future plans that we have. So our Edinburgh Decolonizing Global Health Group is a student-led group of international postgraduate students studying global health and global health policy at the University of Edinburgh. While our more immediate inspiration to create this group stemmed from seeing fellow students such as the Decolonizing Global Health Group, as well as the work of some passionate global health scholars and practitioners such as Professor Madhu Pai. Each of our group members had our own personal experiences and motivations for wanting to partake in this movement. As captured in our YouTube channel series, What Does Decolonizing Global Health Mean to You? Our team's reasons varied from witnessing power imbalances between high-income countries and low-middle-income countries in terms of quote-unquote expertise and framework applications to issues surrounding language and the historical roots of global health. Personally, I previously studied the history of science and medicine during my undergraduate degree, and it was there that I kind of became exposed to the history of global health in terms of its development from tropical medicine to international health, and then ultimately global health. So the historical roots of this name, I think, really attach the power dynamics and the directionality of expertise and knowledge to what we see as global health. And from my experience, you know, the name global health seems to imply some kind of inclusivity, but at the same time, we see that it's taught in institutions and conceptualized very much as like high-income countries leading the agenda and them trying to make the health better in low and middle income countries, rather than about like equitable partnerships and collectively producing and sharing knowledge that's valuable to everyone. So this kind of touches on this feeling of discomfort in language and practices that a lot of my teammates shared, regardless of their specific personal backgrounds. So together, all of these things kind of spurred our team to develop and host the first UK-based student-led Decolonizing Global Health Conference, designed to raise awareness of the global health movement and to help us think about practical solutions for making global health more equitable. Our conference brought together Professor Madhu Pai, Professor Yap Bom, Dr. Faraha Asani, Dr. Ngozi Arondu, and the Duke Decolonizing Global Health Student Group. Our conference had over 380 participants from 41 different countries around the world, and we've also uploaded our conference to YouTube, and that's had over 500 views already. So it's clear that there is interest. You know, the numbers are really telling. But at the same time, we saw a majority of our participants coming from high-income countries. So this kind of raised some questions and made us reflect about who's currently leading these discussions and versus like who needs to be more involved and what our role can be in providing space. For example, when we were initially planning our conference, we only had speakers from high-income country affiliated institutions. Professor Pai, like, thankfully helped us see this blind spot and enable us to get in contact with Professor Yap, who ultimately in our conference offered some really deep insights into the importance of Africans as scholars and researchers seizing their own narratives and developing locally relevant solutions. So while his points kind of echoed those of our other speakers, they were really localized, valuable insights that would have been missed if he hadn't been part of our discussions. So now I'm going to pass it on to Marike to talk about some positive changes that we've already been seeing at the University of Edinburgh.
Yeah, so on Twitter before this conference, I think there was a lot of talk about how we can actually move beyond just talking at conferences to creating change. And we wanted to highlight some of the positive changes that we've already seen to show that it's possible to, approach a bit of change. So after the conference, some of the staff at our university actually approached us and told us they listened to the conference, which was great for us because they were the people we initially wanted to reach. And we organized a workshop with them where we discussed what we thought could be changed at our institution. And what we reached together with them was that we now have a Decolonizing Global Health Society with staff and students. And that actually helps us to continue to have this conversation at the University of Edinburgh, because most of us are leaving the university in this year, and we hope that the space for the conversation will exist after we leave the university. And then we are already looking into reading lists at the moment and into changing reading lists. We are looking into our curriculum. And we've also started to talk to researchers about their grant applications and the way they are conducting research. And we've actually heard a lot of positive feedback, and we've also seen people really changing their ways. And then last but not least, this is maybe not so tangible, but this is a growing movement, and this email we received from a student in Zimbabwe really shows, I think, that a lot of people are seeing that there's a community they feel they can fit in. And the person also said they are looking forward to the next conference, so I hope they are here. And we personally, we are looking to lean out a bit more and more use our role to connect people in the field of global health.
Yeah, as you see that there is a big leap of this challenge. As a global health student, the decolonization is obscure from the global health program, and there is not much discussion and preparing students before they are going to the real world. Our future plan will be in our program. It is an effort to integrate decolonization in global health course and providing pre-departure training for students who are going to the field works. We also plan for the next year Decolonizing Global Health student group cohort, who are PhD students in our group, to continue these movements. As you see, there is a momentum of student-led movements since 2019 from Harvard School of Public Health, Duke University, University of Edinburgh, Karolinska Institutet at this time, and then London School of Hygiene and Tropical Medicine in the next coming conference. It means that the global health network is expanding, so we will engage and support activities in this network. Moreover, we have launched a podcast series, and surprisingly, Dr. Renzo is our first guest, so you can catch up it and the following episodes on our YouTube channel. We also build a Google group to be a platform of sharing information and opinions among global network. You can join us by searching in Google group. There will be an up-to-date documents, and you can share your own opinion too. We hope that it will be a useful platform to link this network. Finally, we start with discomfort in global health study, and this is still a challenge. So we should embrace and realize it to make a change in our practice in the future. Decolonization is a process, so it is a continuous movement toward equity in global health. You can be part of this movement by joining us at Decolonizing Global Health Edinburgh on YouTube, Twitter, and Google Group. Thank you again for having us today.